Welcome back. Politics is an ever-present part of our daily lives. Whether you like it or not, Americans have become increasingly frustrated with the partisan games that are commonplace on the state and federal level. Healthcare has become one of the main focuses of politics. Whether it's the ACA, insurance, regulations, or healthcare laws, politics and our health are always around the top of the list of voter interest. This interest will continue to grow as our population ages and healthcare becomes a larger and larger slice of the government budget pie. I had the chance to sit down with Kentucky's 6th District Representative Andy Barr in his office in Washington, D.C. to talk about healthcare and politics. Dr. Ryan Stanton here in Washington, D.C. in the Longworth House Office Building. I'm talking today with Andy Barr, Representative 6th District in Central Kentucky. And we want to talk today because we're friends and we've spent a lot of time talking about healthcare. And that's what we want to talk about today is politics and healthcare. Clearly something that's been growing significantly over the years. It's becoming more of an issue as we become carved out more and more of the GDP every year. So give us a little idea of your experiences and how you became interested in the healthcare aspect of legislation.
Well, as you know, Doctor, healthcare represents about 1/6 or 1/5 of the entire gross domestic product of our country. So it's a critical issue for families, but also for our economy and for the government of the United States. And I regret that politics has become so integrated with healthcare. I know that for you and other healthcare providers, doctors, nurses, physician assistants, hospital administrators, that you got into the business of delivering healthcare because you were called to healing. You were called to helping people. You weren't necessarily called into politics. But the fact of the matter is the government is a substantial payer of healthcare in this country. And as a result, the decisions that are made in Frankfurt and obviously here in Washington, whether in Congress or at the Centers for Medicare and Medicaid Services, those decisions have an enormous impact on providers and on patients. And so we have to get involved to be advocates for you as a provider, for physicians, for nurses, for hospital administrators, and especially for our patients, the constituents of the 6th Congressional District. And on a personal note, my family, like so many other families, have been the beneficiaries of wonderful care from doctors and nurses in hospitals. My sister has lived her entire life with juvenile rheumatoid arthritis. She's had dozens of surgeries. We've had great orthopedic surgeons. We've had great anesthesiologists, rheumatologists, and we're very blessed to know that there are great physicians and healthcare providers out there who improve the lives of so many of our constituents, my family included.
Now, one thing that recently has been going on, and we recently had an interview, a two-part interview with an opioid addict. She's now recovered, 10 years out, and clean, and that's a huge issue in our area, Central Kentucky, and especially the Appalachian region. Something that's probably one of the greatest man-made drug epidemics in the U.S. history. Now, recently, you guys have had a lot of talks up here, things to start to address that from a legislative standpoint, from the emergency medicine folks that have been here the last couple of days. That's something we've wanted to take on because it's something we see so much in the emergency department. Where do you see it going in terms of the efforts here in Washington to help alleviate the pressure of the opioid abuse crisis?
Well, certainly in my 3.5 years in Congress, I've heard from my constituents, law enforcement, the judicial branch, the nonprofits who are involved in drug treatment and recovery programs, the education system. We have an epidemic in central and eastern Kentucky and all around this country, an epidemic of drug abuse, an epidemic of opioid and heroin abuse. And in fact, in Kentucky, the problem is particularly acute. We have the 3rd highest overdose mortality rate in the country. And in my hometown of Lexington, Kentucky, we've seen a huge jump in heroin-related overdose deaths. I know you're on the front lines of this as an emergency physician. You see it all the time in Kentucky. And so we responded to that, especially when you hear heartbreaking stories from fathers and mothers and brothers and sisters of loved ones who have fallen prey to this addiction problem. So we invited the director of the Office of National Drug Control Policy to the Hope Center in Lexington to talk to us and to people in the education, prevention, law enforcement, judicial branch, drug courts, and the treatment folks, and also the emergency room people, and then also the recovery people, and talk about these issues, about what are the best practices to combat this problem. What came out of that was the 6th Congressional District Drug Abuse Task Force, where experts from all of these different fields came together and made recommendations to us. We brought those ideas back to Washington. Fortunately, last week we were able to vote on a series of bills to address the opioid and heroin crisis in this country, ranging from NAS, neonatal abstinence syndrome issues, to the need for more money for residential treatment issues, to the access for first responders to Narcan and naloxone, and other potential solutions to this problem, multidisciplinary solutions to this problem, drug courts and the like. So we passed those bills. Many of those brought to bear some of the solutions that were recommended to us by our own task force, and we were able to actually include in the NAS bill, the bill that deals with this neonatal abstinence syndrome problem, where babies are born to mothers who unfortunately were addicted to opioids during pregnancy. A recommendation from a University of Kentucky pediatrician, Dr. Henrietta Bada-Elzy, and we're going to have a federal study to examine best practices and what kind of treatment options are available to neonatal healthcare providers and also obstetricians and pediatricians to treat NAS most effectively, so that we can then communicate to all of those professionals what works in helping these innocent victims of NAS actually move on and achieve their potential and health once again. So we're very excited that we were able to take this first step, but I would just caution that passing a law or passing bills is not the ultimate answer. I mean, this is too big of a problem in our country. We need the institutions of private society. We need doctors. We need healthcare professionals. We need the nonprofit community. We need the faith-based community. We all need to work together, because this problem can't be solved just through one piece of legislation.
And that's it. As people, we've talked about it before on the program, that it's pervasive through every level of our communities now. And whether you have a family member, a neighbor, a friend that has been touched by opioid addiction, it will touch you, whether it's through community services, whether it's access to care, whether it's through your pocketbook with the costs associated. The antidote medicine, Narcan, has, over the last 15, 16 years, has multiplied by 18 times in its cost. So the cities are they're having a huge crisis with getting these medications available. And I'd imagine, and our concern a lot now in the EMS and emergency medicine community is that we may face a shortage there. So there is a lot to do. As a viewer, I want you to make sure that you learn as much as you can, whether it's the stories of the victims, whether it's the costs associated with the challenges, and get involved in helping through getting us through this, because it's going to change. It's going to have a lot of change when it comes to the practicing guidelines that we use to actually give opioids in the emergency department and throughout healthcare. Also, the recovery resources that are available, which is the main issue. We're not going to fix the problem until we remove people from the problem. All we're going to do then is change the substance, which is what we've done now with the heroin aspect of things, and also understanding what we can do as communities, large and small, to help take care of these folks. Representative, I really appreciate your time. Thank you so much.
Great to be with you, as always, and thanks to the American College of Emergency Physicians and all that you all do.
We'll keep up the good fight. And thank you. Stay with us. More StantonMD coming right up.